Hello, and welcome to Use of a Structured Educational Program to Expand the Knowledge of Certified Registered Nurse Anesthetists, or CRNAs, regarding post-traumatic stress disorder, PTSD, and the existing body of research of 3,4-methylenedioxymethamphetamine, or MDMA, assisted psychotherapies in patients suffering from this disorder and others alike, by Brittany Williams. The learning goals of this educational module include to demonstrate understanding of the need for improved pharmacotherapies for PTSD treatment, to demonstrate understanding of the occurrence of lifetime PTSD in North American adults, identifying factors that have prevented MDMA as a viable adjuvant to clinical practice, identify how MDMA differs from ecstasy, describe the clinical effects associated with MDMA, and finally identify the potential for future MDMA use in the clinical setting. Background of the problem. First, we have to start with understanding PTSD's prevalence. PTSD diagnoses are challenging to establish secondary to the heterogeneity of symptom presentation. As reported by the National Comorbidity Survey replication, lifetime incidence of PTSD in adults in the United States and Canada ranges from 6.1 to 9.2%. It may be significant to note, however, that the need to explore past trauma often drives patients away from seeking medical help altogether. Resultantly, the true prevalence of PTSD is a challenging value to capture. Per a National Epidemiologic Survey on Alcohol and Related Conditions, or the NESARC study, PTSD life prevalence was higher in women at 8.6% than men at only 4.1%. Among individuals with lifetime PTSD, only 59.4% sought care. Additionally, an average of 4.5 years elapsed between diagnosis and initial treatment. Overall, more up-to-date research is needed to capture the true scope of this issue. So, what are the consequences of PTSD? The consequences of PTSD are vast but capturable. These include reduced life quality, associative depression or major depressive disorder, obesity, hypertension, suicidality, and an increased risk for emergence delirium status post-anesthesia. So, what is currently being done in an effort to treat patients suffering from post-traumatic stress disorder? The first-line treatment modality for PTSD patients has been unequivocally identified as psychotherapies. And though deemed effective throughout the research, this mode of therapy involves dedication on behalf of the patient's time, in addition to potential trauma-focused therapy sessions that may in and of itself induce signs and symptoms of PTSD. Additionally, the medications approved by the FDA, paroxetine and sertraline, in the treatment of PTSD were outlined over 2 decades ago, and the research has shown an overall low response rate to these pharmacotherapy options. Additionally, the search or development of any novel medications has since remained stagnant. The suggested intervention, or what this module is trying to get across, is the future use of MDMA in clinical settings. And why? Well, what is 3,4-methylenedioxymethamphetamine? It is a ring-substituted methamphetamine first synthesized in 1912 as a precursor to a hemostatic substance by the German pharmaceutical company Merck. MDMA is an enactogen drug classification. Doses range from 75 to 125 milligrams. Its peak effect is reached in 2 hours. Its elimination half-life is 8 hours. And most importantly, MDMA is an abbreviated version of a single chemical compound that is a component of ecstasy tablets. These are not the same drug. Mechanism of action of MDMA. MDMA is an indirect serotonin, dopamine, and norepinephrine agonist. It is also a mechanism-based inhibitor of the CYP2D6 enzyme and acts to increase the release of oxytocin and vasopressin. To better grasp MDMA's mechanism of action, let's review normal physiology. Look at the picture on the top right of the presentation. In the terminal end bulb, there are vesicles encompassing the neurotransmitter serotonin. When an action potential comes, vesicles are mobilized to the presynaptic membrane, leaving the end bulb via exocytosis. Serotonin then spills out into the synaptic cleft, where it is free to bind to receptors. Serotonin is then principally removed from the synaptic cleft by the way of reuptake. This is carried out by the reuptake protein serotonin transporter, or SERT. MDMA, in various ways beyond the scope of this presentation, disrupts the SERT protein and thereby prevents serotonin reuptake. The same process is repeated with norepinephrine and dopamine with their associative protein transporters. The physiological effects of MDMA that may be beneficial in clinical scenarios include increased emotional awareness, affect tolerance, anxiolysis, mild euphoria, and improved self-esteem. The benefits of the physiological effects of sensory intensification and feelings of closeness are largely contingent on the setting and individual patient receiving the drug. Other physiological outcomes include tachycardia, elevated blood pressure, trismus, bruxism, and motor restlessness. 3 randomized controlled trials and 1 systematic review served to demonstrate the potential role of MDMA in reducing symptoms of PTSD. Based on the review of the literature, there was mixed evidence suggesting that the use of MDMA during psychotherapy sessions could limit the incidence of PTSD. 2 RCTs demonstrated PTSD symptom reduction. 1 RCT did not demonstrate significant initial symptom reduction based on CAPS scoring, although there was a clinically and statistically significant self-reported improvement and reduction in CAPS scores at the 1-year follow-up. And 1 SR provided efficacy of MDMA over ketamine in PTSD and MDD symptom reduction. All studies, however, proved treatment was safe and well tolerated by patients. Take-home points. Chronic treatment-resistant PTSD is a prevalent mental health disorder contributing to reduced quality of life and the development of other physiological and mental comorbidities. Current treatment options are largely insufficient. All studies in this systematic review proved that MDMA could be safely administered in the clinical setting. All studies to some degree proved MDMA as an efficacious treatment option for PTSD. And although MDMA has not yet been approved by the FDA or been made widely available, there is still a promising future for MDMA's use in the clinical setting. Thank you.